Good morning, everyone. I'm Lindsay Goldfarb, Healthcare Education Program Manager at Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insights Series webinar. MHA is excited to host this unique series, which features candid interviews of hospital leaders and will continue throughout 2021. Today's theme is Leading with Purpose. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please enter them into the chat feature. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I'd like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's education programs. In particular, I'd like to thank today's program sponsor, Amwell. A valued supporter of MHA, Amwell is a leading telehealth platform in the United States and globally, connecting and enabling insurers, providers, patients, and innovators to deliver greater access and more affordable, higher quality care. Now I'll hand it over to Jenny Licata, Director of Health Systems at Amwell, to say a few words. Jenny?
Thank you, Lindsay. Thank you, everyone, for having us. Very excited to be here, and I love the topic of leading with purpose. One of our leaders, Danielle Rosella, as you know, she started with Roy and Ito back in 2006, and one of the things she has always said, and I say to my kids as well, is with great power comes great responsibility. And I think as Amwell, as we've gone through the trying times with COVID and we've seen the health systems and what it's done to patient populations, a lot of what we've done internally with communities, physician recruitment, Amwell Cares programs, women leadership committees, diversity leaders, we're really going towards helping communities as we go through the journey with everyone on telehealth. We did go public recently, and we just now, Deborah Jackson is our first African-American woman to sit on the Amwell Board of Directors. So we're very proud to have Deborah as well. Thank you again for having us. Looking forward to this, hearing from Kate. And Steve, I will pass it over to you.
Thank you very much, Jenny, and thank you, Lindsay. And Jenny, what a year for telemedicine, truly a game changer throughout this pandemic. So thank you for everything that you and your team are doing, and thank you for sponsoring this important series. We truly appreciate it. As those who have seen our previous episodes know, the goal of this is to kind of share some unique journeys, perspective stories from our hospital leaders and healthcare leaders in the Commonwealth. We all know that our healthcare system is built on some of the best minds in the world, but each of those minds work differently and are shaped by their own unique experiences and backgrounds. This morning, it's our pleasure to pick the brain of Kate Walsh, President and CEO of Boston Medical Center. Kate leads a 514-bed academic medical center dedicated to meeting all the needs of its patients. These needs often transcend the scope of traditional medicine and include food and housing insecurity, language and income barriers, and advancing health equity within the surrounding community. In doing so, she has become a leading advocate for underserved communities and for all of our safety net hospitals. She has served as a member of the board of the Federal Reserve Bank of Boston. She currently serves on the board of the Boston Public Health Commission, the Association of American Medical Colleges, Pine Street Inn, Yale University, and also MHA. Prior to taking the helm at Boston Medical Center, Kate held leadership positions at Brigham and Women's Hospital, Massachusetts General Hospital, and several healthcare institutions in New York City. Kate received her Bachelor of Arts degree and Master's degree in Public Health from Yale University. To state what most of our attendees already know, Kate is one of the most recognizable and trusted voices in Massachusetts healthcare. We're excited to have her with us this morning, and we are grateful for her longtime service to our community and to the MHA board. Kate, thanks so much and welcome.
Well, Steve, thank you for that very kind introduction. And Jenny, it was great to hear about Amwell's journey, particularly as it relates to the development of women and the diversification of your board. So thanks for having me today.
Thanks, Kate. So Kate, let's go back a little bit. So you're in New Haven and you say, I want to be president and CEO of the Boston Medical Center.
Well,
you obviously had incredible talent, why'd you choose healthcare and how'd you end up here in Boston with us?
Actually, I didn't say that. I said that I wanted to be mayor of the city of Boston.
Walsh.
It must just come with the Walsh gene. I should state for the record, Steve and I are not related. So any nice things he says to me is just because he has to, because I'm on the MHA board. I was actually a history major as an undergraduate, and I was sitting at one of those, get to know the professor and get your grade up lunches. And everyone around the table said that they were going to go to law school. And my dad was a policeman, and I remember him telling me, Katie, you should be a judge. You can't beat the hours. And so that was sort of what my career path was. And this professor just sort of said in passing, you guys should think about healthcare. And I was like, oh, healthcare, like what's that? And then I had a grant in 1975 to spend a summer in an urban agency of my choosing. And it was the busing summers in Boston, and everyone said, stay away from the Board of Ed. And my dad really didn't want me hanging around the DA's office with that criminal element. And somebody said to me, totally serendipitously, what about the Mass League of Neighborhood Health Centers? And I said, sure. Got on my bicycle, rode there. It was where Dimmock is now. And I got a job at Brookside, which is a Brigham Health Center and I fell in love with it. I just absolutely fell in love with healthcare. I thought, wow, this is a problem we can solve. Lord knows we spend enough money. And so by the time I left college, my goal was to run a neighborhood health center. And I kind of do that here at BMC in many ways. It's a big and complicated neighborhood health center, but a big part of what we do is serve a community. And in some ways, hospitals, particularly big systems, are kind of like small cities. So in some ways, I'm kind of a mayor of this corner. We have to plow the snow and make sure that we have restaurants, and so it all kind of, in my mind at least, comes together that way.
Well, there's a crowded mayoral field this time, so there's still time, Kate. If you want to, we were in the room.
I think that would not be a good use.
You remember you and I were with Mayor Marty Walsh one morning, and he said you can never have too many Walshes in the same room.
Exactly.
Always good to be with you. Your team did an incredible job through COVID. I mean, you had so many patients. You were set up the Newton Pavilion. You were taking care of the homeless. You're taking care of people within your facility, in their homes. How have you supported the staff and the frontline workers in what has been a really tumultuous year for all of them?
I cannot say enough about the team here at BMC. I actually get choked up when I think about it. It was, I had this moment one evening when it was the change of shift. It was about 7:00 and people were in a long line to get their one mask for the shift. And people and their friends were leaving, having done 12 hours. And they were like, handing off, it was not, it was like just an incredibly moving event to see people from all walks of life lining up to take care of their fellow man. It was like in a time when there was so much uncertainty for them personally and professionally. It was unbelievable. And it's not to say what I liked about COVID, but what was very heartening about COVID was the ability of all of us, the entire healthcare system, and Steve, you saw this on the calls we were on every day, to really adapt to the conditions on the ground in ways that we never thought possible. For example, Jenny's on the call talking about the explosion of telehealth. I think COVID really enabled that because we had to reach our patients and we had to break down all the barriers around how we typically care for patients and figure out the best way to do that. And telehealth was a great enabler. We went the COVID recuperation unit that we sprung up and that we kind of spun up in East Newton was really just a way to help people who weren't sick enough to be in the hospital but needed to be isolated home, take care of themselves during COVID when they didn't have a home, or they were in multi-generational housing and there were just too many people to recover safely. Our ability to do things like that, literally on a dime, on a week's notice, I think served us really well. And what I hope can persist is our ability to be able to be as creative, as flexible, as responsive to the needs of our patients as we move forward, because I think we should be very proud of what we accomplished, and I don't want to lose that ground.
Yeah, it was pretty remarkable, but you were working for a long time before on issues and of health equity. And this revealed a lot more for you. Is it a renewed focus? Is there new energy, or are you simply someone enthusiastic that everyone is taking up the same call to arms? Where do we go from here with health equity, an issue that has been something you've been focused on at BMC?
Yeah, I think that's a really good question. I had this mental image of coming out of this just incredibly intense 90 days of the first COVID surge into the summer of Americans literally being in the streets in support of a resurgence of the Black Lives Matter movement. And it really made us think, I think if I were giving this talk a year before COVID, I would just at this point launch into a description of all the great programs that BMC has in the social determinants of health space. But what COVID showed us, that even at Boston Medical Center, where half of our patients are Black or Latinx, now with COVID, it was 80% of our discharges. So we realized that even at a place like BMC, where we disproportionately care for low-income people of color, this disease hit the people we serve in such a more dramatic way that it made us really step back and think, okay, what else is it that we need to do? And I think the shift for me as a leader, and I hope the shift and the journey that BMC is on, is to be very conscious about solutions to health equity challenges that happen outside of our organization, but equally conscious of the practices and policies within our own organization that allow health inequities on the basis of race to persist. And that internal journey is really difficult because nobody comes to work to take care of a patient in a way that disrespects them or devalues them in some way. But yet we do that every day. So how do we as an organization really examine ourselves and our own practices and hear from our patients and hear from their families to learn how we can better attack the health outcomes and the disparities in health outcomes that we see in this country based on race and ethnicity. And that's the journey that BMC is on now. And I'm really incredibly excited to see where this takes us. It's painful though. We hear from our employees who are people of color who say, oh yeah, racist things happen here every day. And I'm like, really? And so that journey for me as a white leader is just been, it's been a privilege, but it's a challenge and an opportunity.
Well, and I remember you led really, I won't call it a walk out, a walk with, right? A unity walk after the murder of George Floyd as a leader in the Boston community that spread to the whole healthcare community. That had to be an important moment for your team at BMC too.
Yeah, it was, and we did that in conjunction with medical students, organized labor, politicians. I mean, it was really it was a moment where I think our country said enough, and I think what the challenge for all of us as leaders is to preserve that momentum, and as things quote come back to normal, to not let the new normal has to include much more focus on how racism affects the health of the patients we serve. And it's a learning journey for me. It's a learning journey for our organization, but it also really is just a chance to kind of get back to your values and your roots. I tell the team every time we miss a quality measure here, by definition, it's an inequity because of who we are and who we serve. So we're highly motivated to do the right thing for our patients every day, and we just need to be able to do that consistently and in a standardized way that really just eliminates any opportunity for racism to creep into how we care for patients.
Well, and we have certainly all benefited from your leadership and appreciate it. And you've had a lot of moments of challenge at BMC. I want to point to a moment of joy for a second, and I want you to watch this clip that brought a tear to my eye, a tear of happiness. And if you can reflect on it after our audience sees it, I'd appreciate it. Well, I saw you singing along, which I didn't expect, but what was going on there? What was that all about?
that was just a moment in time. And I really appreciate you showing it, because it really does bring me joy every time I see it. And I've seen it a bazillion times. When the vaccines arrived, we were one of the first hospitals in the state to receive it. And Allison Merrill on our communications team said, I think we should do a video. And literally, like in 20 minutes, everyone said, oh, you staged that. Oh, you brought in dancers. No, the guy in the camel hair coat, the guy in the camel hair coat and the guy in the blue suit kind of went viral. People were like texting me on Twitter, like, how can I meet those guys? One is Armani. He works in our HR team, and he happens to be a Zumba teacher. And we had just hired a new manager of patient experience who is in fact a ballroom dancer. And then, this being BMC, people really literally just got on the sidewalk and started dancing. And it was really just a moment in time. The video went incredibly viral because I think it tapped into the joy we all feel about the promise of these vaccines, what it means for the world. And it was really just a great moment. It was my viral moment. And I was telling everyone I felt like a Kardashian, because like my phone was blowing up all the time. But it was great. And it really is, it's like magic in a bottle. And every time people see it, they love it. President Biden used it in his inauguration parade. I mean, it's really been just a great thing for our hospital.
Yeah, that's awesome. It captured the spirit for the whole healthcare community, and your team deserves a lot of credit for the creativity, but also just the positive feelings that created. Vaccines, though, haven't been all positive, right? I mean, you're running several community sites. What are you seeing now, and what do we need to be doing to get to where we need to be?
Yeah, so vaccines was a great example of another aha moment for me as a leader, where when the vaccines were first available and in wave one in the state, healthcare workers were granted access. We saw almost immediate pickup within our white colleagues. People, I think the data were in the first 6 days, 72% of the people who worked at BMC who are white had gotten at least their first dose. In the first 6 weeks, 32% of our Black and Latinx colleagues had gotten their first dose. And so we went, whoa. And then our experience with our own employee base really framed how we sort of stepped back, did a whole lot more listening and understanding of some of the root causes of vaccine hesitancy, and just general hesitancy. It wasn't only people of color who declined the vaccine. It wasn't only white people who accepted it, and just kind of learning and talking to people, creating opportunities for people to ask questions. We did a lot of town halls. We did a lot of, kind of almost grassroots, almost like retail politics around, how are you thinking about this? Our physicians and nurses and leaders who were people of color were instrumental in doing webinars and talking to people. And now we've kind of taken that act on the road. So you'll see one of our directors in pharmacy on a commercial with the Patriots, talking about why he's a Black man, why people should get their vaccines, and that really led us to think very differently about how and where we vaccinate people. So as you said, we're very proud to have stood up now 6 or 7 community-based sites, and it's very interesting. Those sites, they're kind of like community gatherings. People see people they haven't seen for a long time. And it's really been a great success. And again, that was an example of our team working with the state, working with MHA, just getting out there as quickly as we possibly could to get vaccines into people. And, we've had a few hiccups, and there were times when we probably stretched or broke the rules, but in general, those sites have allowed us to really make sure that the people we are vaccinating reflect the patients we serve, which I'm very proud of.
Yeah, that's incredible. I mean, that's really, I think, the reason why Massachusetts has been doing better than others in equity. We can always improve,
Yeah.
right? It's an evolution, but your leadership there has been pretty remarkable. And so thank you for all, because we all benefit from that. Our ability to become a new normal again and get back to some level of what we had before is going to depend on people trusting in the vaccine and getting the vaccine. Mm-hmm. I want to switch back, because you've talked to me over the years about advice and being a mentor to me. And I know you've had strong mentors in your life, and we're talking a little bit about how you ended up where you are. What's some advice you've been given in your professional career? And can you talk about the role of mentorship in getting you to where you are today?
Yeah, it's really interesting. I think people ask me all the time, who were your mentors? And when I sit back and reflect on it, I think the people who helped me the most were often people doing the same job or similar job. When I was a department head, another department head, or when I was a VP, another VP. Looking up for mentoring is really important because you learn what kind of leader you want to be. But I think the way you get better, the best way to get a new job is being really good at your current job. And the way to be really good at your current job is to learn how to do it better. And that often comes from watching people doing a same or similar job at the same level and seeing how they do things. And I think back to my time when I was working at Mass General, there were 4 VPs. We all happened to be women. We couldn't have been more different. And we all kind of mentored each other and really helped each other along the way. And I think of that time in my career, I stayed for about 14 years, is probably my biggest time of professional growth. And it was really because of the people who I worked with, not for. No disrespect to the great leaders I worked for there, but I think it was really just because people have different ways of approaching their job. And so I often tell, particularly young women, to not, yes, be aware of who's around you and be aware of what it's like to do the job you want to get. But the best way to do your current job is kind of peer mentoring. And that's been my personal experience. I don't know if it's right. I don't think there are books written about it, but it's kind of how it worked for me.
Yeah, it certainly has. And I know that others have spoken very highly of your efforts to help other people enter the field and in other fields. And as busy as you are, you're always making time. I want to, again, switch gears back to BMC, and it's not an issue that's gone away, but pre-COVID, the Graken Center for Addiction, I mean, you were doing so much in some other challenges around mental health, behavioral health, substance abuse. Where are we there, and what work is still happening that you can talk about?
Yeah, no, the team here, first of all, let me just say, I don't do much. I fly a desk, but the team here does just a tremendous job caring for people who continue to struggle, who are struggling with or continue to struggle with substance use disorder. And I'll say 3 things that I've learned from my time at BMC. The first is this really is a disease, and we don't, when somebody's cancer reoccurs, we don't blame them for that. When somebody relapses from their addiction, I think we really have to start as a society reminding ourselves that this is part of the natural course and history of this disease. The second thing is, and I think it's particularly hard given where BMC sits geographically in our city, is that the people you kind of see on the corner, the people who are struggling the most, the people who might scare you when you're walking home at night, are just people we haven't reached yet. They are somebody's mother, somebody's brother, somebody's sister, somebody's kid. And we, modern medicine, with all the great things we can do, and a vaccine in a year, and we still can't successfully treat their disease. And you have to remember there's many, 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 many people in recovery. Every single day you work with them, you live with them, and so that recovery works, and we have to really continue to invest in it as a society. And the third thing is kind of co-occurring behavioral health. That we have got to, as a society, as a healthcare delivery system, kind of double down and think much more deeply about, and I think we're going to see this in waves after we kind of come out of this epidemic, is that there are challenges that we're having in society because we have undertreated behavioral health challenges. And we see it in every aspect of our life every day. If you can't get into the cath lab in 90 minutes, it's a quality measure. We have people waiting 9 days for psych beds and in our EDs. And so I think as a society, what we value and what we choose to treat and what we choose to pay for in terms of treatment, we just really have to think much more deeply and thoughtfully about. And that, I hope that at Boston Medical, I was thinking about this, think about all the quality metrics we report, and think about what's on all our executive dashboards, and then think about how many of those measures directly relate to the behavioral health challenges our patients face. Maybe there's one measure related to behavioral health, maybe there's 2. And so even if you don't have inpatient psych beds, your hospital should have a quality measure related to behavioral health access or something on their dashboard. And I take the bet that half the hospitals on this call don't have that.
Yeah.
And we've got, and that's on us.
And hopefully we put the same level of attention post-COVID, right? Because that's the epidemic within the pandemic that we have all seen and that you've been responding to. As we're coming to the close of our kind of morning coffee together, I want to do some lightning round stuff, see if I can get some questions that came in the chat. One of them's on telehealth, which I'll ask because our Jenny was so good to be our sponsor this morning and share what's happening nationwide. What's going to happen with telehealth in underserved communities? And do you see a challenge there?
I think it is a game changer. And I think the only challenge is to make sure that we get it right. Everybody has a phone and people may not have access to data plans. I think at places like BMC, we're going to have to be more creative to figure out how to reach people. But think about it. Every school kid in the city of Boston went home with a Chromebook so that they could do online learning. Why can't we think about ways to use that technology so that people have access to healthcare? I think it is potentially breakthrough in life-saving and behavioral health and substance use disorder. We were able to stay in touch with our patients. The Great Center was able to stay in touch with their patients on a telehealth platform in a very effective way. Well, but we don't know what we don't know. And what we need to do, we need to be very rigorous about figuring out what the quality measures are, how we track things, ways to create touch points for patients that make sense for them and for us. And I think that it is a great tool. It's not a panacea. And I think like any tool, we're just going to have to practice to learn how to use it better.
And there was a question, we'll keep switching gears here about your Medicaid ACO. You were certainly a leader in this space before COVID. Has it changed as a result? And what do you think the future of your ACO program looks like after the pandemic?
I still think, even though we had some very rocky times early on at BMC in our ACO, that thinking about how to spend the Medicaid dollar, which is such a precious resource, in a way that improves the health of the communities we serve. I think we and the state are on the right track here. We argue a lot about how much fuel there is in the engine on that track, but I think that we are definitely doing the right thing here. What we have to think a lot about is how do we infuse much more intention around health equity into how the Medicaid dollar is spent to ensure the health of the communities we serve, not superb coverage for the episode of illness that I think we're doing now.
And you're doing so much around social determinants of health. How are you measuring that within the communities? Can you see that it's having a positive impact?
I think that we need to get better at measurement across the board. I think that this is a long arc that we're trying to bend, and I think that the communities that most benefit from interventions around social determinants of health are challenged not only in healthcare, but in employment, in housing, in all the things that we're trying to at least understand better as healthcare providers at BMC. And so we're thinking a lot about place-based investing. We have a big grant from JP Morgan Chase that looks at both economic development and as a way to improve the health of communities. And healthcare organizations are trusted leaders in those communities. So we're actually able to, I think, help convene people in ways that might be useful. Although the jury's still out on that. There's a lot. I mean, this is probably a whole separate set of conversations, but I think the hardest thing as healthcare providers who enter into the space, that we just have to be better listeners. We have to be better partners to community agencies that have been doing this work for decades. And big, busy hospitals aren't so great at that.
Well, you're doing an incredible job. And one of my favorite moments in the early days of visiting you was seeing a prescription for food, so that you were breaking down stigma and visiting the garden and all the incredible stuff you're doing. I'm going to ask you a one-word question here to close us out as we come up on our time.
That's going to be hard for me, Steve, but I'll do
I know it's hard for anyone. We can talk underwater. It comes However, lots of people from Boston in the Biden administration. One of our listeners wants to know, are you open to a national role?
No. Somebody asked me that, and I said, my life's ambition is to be a backup singer. So if I can go on a national tour as a backup singer, that would be really fun.
Well, we know that you today are a lead singer and doing an incredible job. Kate, thanks for joining us. Unfortunately, we've come to the end of our quick morning coffee together, but these have been so helpful, I think, to our audience, and great to be able to get to know our leaders in some different ways. I've learned so much from you. I know the rest of our leaders in our community have. Thank you again to Amwell. Thank you to all of our sponsors and all of our attendees for being a part of today's Executive Insights series. MHA offers virtual programming like this every week of the year. We encourage you to visit our website for more information and to join us for our next Executive Insight session on May 19th, when I'll be joined by Dr. Kevin Churchwell, President and CEO of Boston Children's Hospital. So don't forget to mark your calendars for one of our upcoming conferences. MHA's Spring Forward Leadership Summit is tomorrow from 9 to 12. So if you haven't yet signed up, there is still time. Thanks for spending your morning with us. Kate, thank you again for joining us. It's always a pleasure. And I hope you all have a great morning.
Thanks for having me. Bye, everyone.